So Doc, tell us a little bit about your journey to find yourself here as a practicing physician to working with medical cannabis every day.
I'm a clinical professor of medicine and rheumatology at both Cedars-Sinai and UCLA. But I'm also in private practice in rheumatology, and I see patients in my own practice. My patients are often patients who are in chronic pain, and they have an impaired quality of life due to their pain, and I want to do whatever I can to reduce their pain. And we have some standard allopathic medicines that we use, but sometimes they're sensitive and can't take them, or they don't work. And they come back to me as a court of last resort. What do I do? And I began to realize that there's another pain pathway that we can use, and that's cannabis, which may affect their perception or reaction to the pain as well. And I also realize, as somebody who uses functional medicine, that these same patients who are in pain often have nausea and sleep disturbance, and actually cannabis has effects on multiple systems. So we have a medication that may help them manage their pain, but may also affect multiple other systems. So I began to get interested in this. I actually was then asked by a national specialty organization to give a national talk, and I actually visited dispensaries, collective growers, and in the field, and learned a lot about the whole process as well, and then began to use it more widely in my practice. Then it also led to my interest in the preclinical work, and we've heard in this program from Rafi Meshulam, there's some great work at Hebrew University suggesting possible applicability in bone. When I see my patients who come into me who are on opioids, then I start talking with them about the fact that there is a condition called opioid-induced hyperalgesia, where with time they will need higher and higher doses of opioids, since there is good data to suggest that the opioid receptor gets downregulated. And so I like to use cannabis in those patients to help them taper down on their opioids, which I think is extremely important. And then it improves not only their opioid needs, but actually often improves their functionality.
What are some of the issues that you've seen that would make you think cannabis is going to be a good fit for them?
Well, first of all, remember, Jim, that I'm a rheumatologist. Okay, so as a rheumatologist who's treating people in pain, first of all, pain most, but as I mentioned earlier, I might be seeing some sleep problems, fitful non-restorative sleep, some nausea. Those are the top ones I see, but certainly also it has effects on muscle spasticity, which I can see in some of my patients. Certainly some of my patients have mentioned their effects on glaucoma as well, and generally it can be used for a variety of other conditions beyond those. It's been used widely in HIV and in cancer, and also in inflammatory bowel disease, now some signals. I'm certainly very intrigued by some of the newer, really exciting control data in pediatric populations, particularly in children who had seizures nonstop that was resistant to other therapies, that we can stop or reduce the frequency of seizures. And now we're seeing some other signals in patients who are children who've got a blood cancer, where we wipe out their bone marrow, give them a donor bone marrow, but occasionally the donor bone marrow actually attacks the child. And that's called graft versus host. And there's some signals that are now leading to formal clinical trials that it looks like that can slow down, prevent, or treat this illness, graft versus host, which can be fatal.
So Doc, one question that's come up a lot. What are terpenes and why are they relevant to medical cannabis?
Well, terpenes are one part. There's several hundred compounds in cannabis. Certainly we are all familiar with CBD and THC, and people are less familiar with terpenes. Terpenes are fragrant oils that impart some smell and taste, so some people may notice when they taste an oil, it doesn't taste so good. That's often usually the terpene. But the terpene may become important too. It can interact. There's something called entourage effect, where you get the whole plant works together. So terpenes can help. They might, for example, in some terpenes help the cannabis cross the blood-brain barrier. So they're actually an important part of the equation as well.
Can you tell us a little bit more about the entourage effect and what it is?
The entourage effect talks to whole plant medicine. And what we've learned is some of the compounds in cannabis that we're most familiar with, such as CBD or THC, actually may have more efficacy if they're combined together or with other compounds in a plant. So there's an additive effect when you add more compounds together. Remember, there's several hundred compounds in a plant.
What would you say are the advantages of using a non-allopathic strategy, like you said, like using something like cannabis in practice?
Well, I use the cannabis in practice for several reasons. First of all, I'm trying to achieve better pain and total body management, not only of the pain, but of other associated symptoms we talked about, like sleep. I also use it because I often see patients in pain who are already on opioids. And we all know that opioids have their limitations. We're all aware of the opioid epidemic. We're all aware that with time and increasing doses, you get something called opioid-induced hyperalgesia, where you downregulate all the opioid receptors and it stops working. And the patients think they got to keep increasing the dose, but then that leads to significant risk. So when I see a patient who's on opioids, one of the first questions I have is to start talking with them. Can we use cannabis to help lower your opioid dose? And I think that's an important part of a dialogue that I have with my patients as well.
When you go to these rheumatology conferences or otherwise, do you see other rheumatologists who are interested in this conversation?
My peers generally don't know very much about it at this point. They hear from patients that it might be useful, and they'd like to certainly learn a lot more about it. And I think we've heard earlier in this program today from Jeff Chen on our efforts through UCLA to help educate physicians. I think some physicians at this point are reluctant to discuss it, perhaps because they don't know what to say to their patients. And others are hesitant to use it because of their concerns. And I think this raises some concerns on the part of patients. Do patients tell the physician that they're taking cannabis or not? Is there a risk of losing that doctor who seems really good? I myself discuss it. So my patients with pain management, I'm going to be open to their using cannabis while they're using their opioids, because I'm going to say, let's use it to help reduce your opioid dose. It's not here we're using it to help reduce the opioids. That's my target.
So Doc, can you tell us a little bit about some of the health risks and side effects that you see in working with your clinical practice with medical cannabis?
Well, I think the first thing I'm most concerned about is the fact that, as a physician, I'm not recommending for recreational use. So THC, as we know, is usually psychoactive. Many of my patients in chronic pain have secondary depression, anxiety, panic disorders. They're psychologically brittle. They've been through a lot. Pain can be really demoralizing. When I give them if I were to give them THC or a high THC content cannabis, many of them say, I tried it, I really didn't feel very good. What happens is it can actually exacerbate some of their psychological problems in various ways. People who are chronic users can get a variety of problems, including cannabinoid-induced hyperemesis, which we've actually seen in the emergency rooms, people who are having nausea and vomiting nonstop after cannabis. So there certainly are definitely some risks. And of course, if one is inhaling it and you have underlying lung problem, it couldn't be detrimental. No data actually showing definitely cancer risk, but clearly could be irritating to the lungs. So I think the physician and the patient need to have a dialogue about the risks and benefits.
So Doc, one of the things in our functional medicine community, we have a lot of practitioners who are working with patients that have chemical sensitivities or other things. What did you learn on your trip that could help to inform other practitioners to get the most out of medical cannabis?
Since I do fibromyalgia, one of the components of fibromyalgia chronic fatigue is multiple chemical sensitivity. They're so sensitive to light, sound, and smells. Well, they're extremely sensitive to chemical components as well. And so in my original journey, I actually did field trips to local dispensaries, collectives, growers, etc. And I learned, for example, that much of the cannabis that's grown indoors might need to be treated with pesticides, fungicides, or there could be mold, for example. So I think it's really important for the consumer, that is the patient, to ask, is the cannabis that they're going to consider putting in their body, has it been tested with a toxicology report? Some For example, one collective I know holds it in escrow until the toxicology report is done, and if it's positive, they reject the crop and will not distribute it to their members. So I think this is really important. Some states actually, like Colorado, actually have laws at the moment which actually require some toxicology done.
So, Doc, maybe for our audience at home, you could take us through what are some of the most popular delivery mechanisms for medical cannabis, and which ones do you recommend for your patients?
Well, there's a variety of delivery mechanisms. Our patients are probably most familiar with smoking it, actually, as a joint or, for example, or through a vaporizer. But again, I mentioned, older patients, older adults, it could be irritating to some of them. Edibles are often considered, but edibles are tricky. You don't know when it's going to be absorbed. So you take an edible now, it's not necessarily going to have an immediate effect. It might be several hours down the road, and that's not giving you the immediate relief you want medically. Might be good for sleep, but it's not giving you that immediate relief. And will you be driving at that point? Will you be taking care of your kids? So, we tend to move on to other forms. The other problem with edibles, for example, is they tend to use the marijuana, but the marijuana is actually dissolved in fatty-like compounds like butter. So the distribution of butter on a brownie sheet can be very different. So one corner might be relatively dry, have minimal cannabis content, and the other corner have double or triple. So there's a kind of irregularity here. We need some good marijuana bakers. But the other issue here is also it can be interesting. Simple edibles like gummy bears only have it on the inside. There are some edibles now that have an outside crystalline coating, so you get more immediate action, and then you get a delayed reaction. My preference is to move on to sublingual delivery, which could be a tincture or an oil, or a sublingual nasal spray, where the absorption is fairly rapid. I think it's all part of a functional medicine program. So again, getting back to my patient with chronic pain, to me it's a facilitator. If I can use a medication that lowers your pain threshold, my goal is to get you to exercise and be more physically active. So to me, I tell patients, I want you to use this so you're going to be more active. Once your pain levels start dropping a little bit, there's no excuse for you not going out and exercising and working. Because again, the exercise is really what we're aiming for. The cannabis is, to me, it's the start, gets you to first base, but to get you to home plate, you're going to have to eat well. Your physician will go over your nutrition, your diet, but also a exercise program, which I regard as a prescription, not simply go out and exercise. I actually spend the time to talk to my patients about what we need to do in terms of their exercise.
So, Doc, what are some recommendations that you'd have for other physicians who are thinking about recommending cannabis to their patients but haven't taken the leap?
I think the patient, as a consumer, and the physician need to be aware first is the THC content, because it is psychoactive. And I've had patients who before they came to me and no one had asked them about it, went ahead and tried some cannabis, which was very high THC content, and had a psychological adverse effect, which we discussed earlier. And they didn't really want to try it again. So I actually, when I work with patients, I'll either start with a pure CBD or more likely a low THC content. We say 20 to 1 or 25 to 1 CBD THC, or no more than 4 to 5% THC, so we get started. Now, admittedly, some of the studies like in HIV neuropathy have shown you have best effect at 1 to 1, but I think I don't start there, because I have to respect my patients and how they react to it, because we're dealing with multiple systems again that are affected by cannabis.
I know you're very passionate about bone health and bone disease. What are some of the bright sparks and green shoots in the area of bone health and medical cannabis?
Well, in this program, we're going to be hearing a little bit about from Rafi Meshulam at Hebrew University in Israel, and that group and others have looked at effects on bone, and there's some signals that for example, in rodents who undergo menopause, that we might be able to prevent or treat. And there are other signals in another disease, osteogenesis imperfecta, which is the brittle bone disease, where children or adults get multiple fractures. It might be a help. We don't know this. Studies are are on the way. This is all preclinical, not yet in humans, but I think it shows great promise in another system. There are some specific receptors in bone.
Doc, I know you said that there were some issues with product labeling, and that's been something that you've seen on your travels. What are some of the issues that you've seen, and what could be a solution for that?
Having, as part of my journey, visited dispensaries and collectives, when I walked in, I was overwhelmed. And I think that the patient as consumer is also overwhelmed. It's kind of like the consumer in the candy store, except someone took off all the labels. You don't really know. There are all these names for these strains. You have to ask a lot of questions. Is this an indica strain? What is it? What percent THC? I think that we need more transparent labeling. I've seen some beginnings of that in other states such as Colorado, indicating percent THC content, but also we're not labeling potency. The cannabis that my generation of baby boomers smoked decades ago is weaker compared to the potent strains we now have. So I think we really need to have more open labeling and discussions so the consumer can choose better. And I think as a physician right now here in California, I can only recommend, I can't prescribe. So we really need to be able to have the consumer who walks into the dispensary collective be able to have a reasonable, intelligent conversation until we get to the point where labeling is more transparent.
So what would you say to other doctors who are sort of sitting on the fence, not willing to sort of jump in and start to use these tools?
Their task is to learn more about it. I think as physicians, we need to feel comfortable discussing it with our patients. It's not surprising that I think many of the patients out there know more about medical cannabis use than do their physicians. So I think working with Jeff Chen, we've heard earlier in this program, there's an effort here at UCLA to try to educate physicians and increase their awareness so they do feel comfortable in talking. And I think patients also really appreciate the fact they know their physician is working with them. And I think it's a dialogue and it's a conversation that can really have dramatic results in terms of decrease opioid use, improve functioning, and really help manage patients. Medical cannabis is an important part of a physician's armamentarium, but we're going to need to use toxicology reports. We're going to need to standardize it. We're going to need to have better consumer labeling. Yes, I think it's a great start that here in California it will be available in January, but I think we need to work together to make it more consumer and physician friendly.